My name is Sharizwan bin Abdul Rahim. I would like to introduce the member of this group project. First, we have Muhammad Farid bin Mustafa Kamal, Najiha binti Muhammad Nur Azman, Nur Aina Batrisha binti Yazid, and Muhammad Syamil Al-Farhan bin Syukur.
The first COVID-19 cases in Malaysia was reported in early 2020 and it spread rapidly across the country. The Ministry of Health led the national healthcare response, including testing, treatment and vaccination efforts. Frontliners faced high risk while hospitals were under immense pressure due to the rising number of cases. To control the spread, the government enforced movement control orders, which known as MCO, with the help of the National Security Council, police and the army. The pandemic had a major economic impact, especially in the tourism and hospitality sectors, leading to widespread job losses. It also affected mental health, with many experiencing of fear, stress and emotional isolation. Students also struggle with their online learning due to poor internet access and limited device. In response, various ministries provided financial aid, food support and other assistance to help the public cope during the crisis.
For the short and long-term planning. In the short terms, the ministry acts fast to protect people and control the virus. Was focused on urgent actions to control COVID-19 during the early stage of the pandemic, especially between March 2020 and mid-2021. For example, MAEPS Quarantine Center. The government converts MAEPS into quarantine center for low-risk patients to reduce hospital crowding. Next, retired nurse. 3,000 retired nurses will call back to support overwhelmed healthcare workers. Next, MCO movement controls orders start on 18 March 2020 to limit movement to reduce the virus spread. The last one is medical budget. 1 billion was allocated to improve medical equipment and facility. Net for planning effort, time frames and objective. So, what was the goal behind all this plan? The ministry have 5 main objectives. The ministry divide their efforts into 2 time periods, short terms and long terms. Each had different goals and actions. Time frames, example, short terms, March 2020 until mid-2021, immediate crisis control. Next, for the long term, 2023 until 2038, future reforms and system improvement. For objective example, to stop the virus from spreading quickly, to prevent hospitals from being overwhelmed, to give better access to healthcare even in rural areas, to prepare for any future pandemics or health emergency. The last one is to improve digital healthcare and good governance. For the multi-stakeholder involved, this pandemic was not managed by one agency alone. It was combined effort involving both governments and private partners. COVID-19 required teamwork. The Ministry of Health worked with many local and international partners. For example, COVID-19 required teamwork. The Ministry of Health worked with many local and international partners. Local agency, the National Security Council and NATMA helps coordinate response and policy. International partner, WHO and UNICEF give technical advice and global best practice. Academia, research support camp from Aquibi Institute and Monash University. Last, private sector, insurance providers and private hospitals help provide care and testing.
I will explain the importance of organizing, especially in a public health crisis like COVID-19. Organizing plays a vital role in managing resource and improving the overall response system. First, organizing ensures the efficient use of resource. When we organize properly, we can distribute essential items such as medical supply, hospital bed, and vaccine based on urgency and actual need. This helps prevent shortage and ensure that resources are used in the most effective way possible. Second, organizing improved coordination and response. With a structured system in place, health authority can clearly assign tasks, streamline contact tracing, testing, and quarantine procedure. This avoid confusion, prevent overlapping responsibility, and speed up the overall response. Let's take a look at the organizing strategy using during the COVID-19 crisis. Firstly, centralized and efficient coordination. The Ministry of Health activated the Crisis Preparedness and Response Center, or CPRC. This center helped manage testing, quarantine, hospital resource, and case reporting across the country in a centralized and efficient way. It played a key role in ensuring the response was well coordinated nationwide. Secondly, the effectiveness use of technology and partnerships. The My Sejahtera app was used for digital surveillance and monitoring. At the same time, there was a strong collaboration between the Ministry of Health, police, secure force, and NGOs. This partnership helped ensure fair vaccine distribution, the enforcement of SOP, and the ability to reach vulnerable groups effectively.
I will explain 2-point decision-making strategy. Point 1. Public health measure. First, public advice to wear face masks in crowded and enclosed place. Second, Movement Control Order (MCO) implemented on 18 March 2020 to restrict movement and limit virus spread. Third, MOH collaborate with National Security Agency to enforce the MCO. Second point, vaccination program. First, COVID-19 immunization program led by Khairi Jamaluddin launched on 24 February 2021. Second, program structure into 3 phases. For phase 1, for frontliner such as doctor, nurse, police, and military. Second phase, for high-risk group such as elderly, chronically illness, and person with disability. And the last one, phase 3, general population aged 18 and above. Next, I will explain 2-point ministry action with principle of management. First point, planning and organizing. First, organizing is a key principle of management involving structure planning. Second, the ministry organized schedule for medical supply arrival and patient accommodation. Third, proper planning ensure alignment with medical standard operating procedure SOP. 4. Efficient scheduling prevented overcrowding and ensure timely treatment and research allocation. For the second point is leadership. First, leadership involves directing and motivating teams to achieve organization goals. Second, Khairi Jamaluddin, former head minister, demonstrated strong leadership during the vaccine rollout. Third, he motivated team and led the national immunization program effectively. 4. His leadership contributed to widespread vaccine distribution, including to children, helped to achieve herd immunity and reduce infection rate.
Next, let's see the definition of controlling. Controlling is the installed process to guide the team toward the goal and monitoring a performance. It includes measuring actual performance and comparing it with set standards. Next, let's see the purpose of the controlling. The purpose of controlling is to ensure that the organization make a progress towards to the goal. Secondly is to identify and correct problem. The organization will make identify to solve the problem. Last, to maintain discipline and accountability. The organization must. The last one is to maintain discipline and accountability. The discipline is very important because to provide a consistent and fair approach to handling misconduct and performance issue. Let's see the minister action with controlling. The first one is set standard and the guideline. Government make the issue with SOPs such as wearing a mask, social distancing and travel restriction. The government also set the healthcare capacity targets like a number of bed, vaccination rates and the staff of hospitality. And the last one is the minister also track daily COVID-19 cases state or recovery with official health data. The second is to declaring a public health emergency. This is to make to active the emergency protocol quickly. It also a signal that the situation is very serious or a special case. The minister also made a legal authority to enforce the SOPs like the quarantine and the lockdown. Which emergency power decision can be made without a delay and no need go to with slow bureaucracy.
In conclusion, the Ministry of Health (MOH) managed the COVID-19 pandemic using a SWOT analysis to guide their strategy. For strength, MOH relied on core values like caring, professionalism, and teamwork. Frontliners continued to serve under pressure, and MOH worked closely with private hospitals, NGOs, and volunteers to boost capacity. Clear communication helped speed up decision-making. However, weaknesses include skilled workers moving to the private sector and rising medical costs. And the opportunity was Malaysia's growing reputation in medical tourism with quality care at affordable prices. Last but not least, a key of threat was misinformation, especially on social media, which caused confusion and reduced public trust. Moving forward, MOH should focus on improving healthcare, worker benefits, providing mental health support, and continuing public-private partnerships